My name is Marie Wright. I'm a foster care specialist for the Department of Health and Human Services. The social work field is huge. When I first went to school for social work, I started off working in an assisted living home with elderly people. I then moved to what's called Every Woman's Place in Muskegon, and I worked with domestic violence and sexual assault victims. Social work is a human service, so you can find careers in social work, whether that be in nursing homes, hospitals, in the community, in public agencies, housing agencies, working with children. I guess it's an umbrella field where you can pretty much find a social worker in any setting that is going to be dealing with the difficult problems or the social problems within that agency and dealing with people. Typically, they require a bachelor's degree in social work, human services, something of that nature, to work for the department in child welfare. There's so many people who usually when you talk to them, they're like, oh, I never thought I'd be a social worker, but here I am. I had a lot of hardship growing up through like middle school, high school age, and so I knew then I wanted to help families. I wanted to help children who have been through what I've been through. I recognized issues like substance abuse, physical abuse, things of that nature, neglect. I felt like I understood them, and I felt like if I could relate with a family, a mom, a daughter, and help someone through something that I had been through, that I wanted to do that. And so I didn't know how exactly I was going to do that, but I knew I wanted to help. Someone who would do well in social work is probably going to be compassionate, is going to be non-judgmental. My advice would be to practice and to learn how to work with people. It's very important in my job that you meet people where they're at. The way that you view something, you can't jump in and work with a family and expect them to see things and do things the way that you would do them. You have to meet them where they're at and really learn not to judge. I love my job because I feel like it's my calling. I love social services in general, but I think working with children and families, especially in the community of Muskegon, I feel I'm very familiar with the community and I relate well with families. I would say that social work, especially in child welfare, is very demanding, sometimes even scary or difficult. It's very emotional, but I think because those things are so difficult and emotional that when you do have success, they're that much more rewarding.